Hey guys, Dr. Soni here today. Today I'm going to show you my cannula technique to do the perfect cheeks. There are many different techniques when we do augment the cheek. I truly believe that the cannula gives me the precision as well as it makes the entire experience quite comfortable for the patient. And our entire goal when we do the cheeks is to pay attention to two parts. The ideal cheeks, especially in Caucasians, tend to be where you have kind of the apex of the cheek produce the maximum light reflex. And the reason we put a little bit of product here is there's a fat pad underneath the orbicularis oculi muscle called the SOOF. And what we're really doing is we're enhancing the lateral component of the SOOF. Oftentimes, just placing fillers deep in the pre-zygomatic space underneath the SMAS will also help support the tear trough region. In general, I don't inject filler in the tear trough unless I've optimized correction of the lateral SOOF as well as the medial aspect of the cheek. This is known as the piriform space over here. Now, traditionally, we've been taught to just go needle on bone over here, aspirate, and inject about, typically you don't need a large volume, although this place, if it's deficient, can accommodate a little bit more volume, sometimes as much as 0.5, 0.6, 0.7. But remember, our vasculature is there, so you do have to be careful. I find that while a cannula is not foolproof, it's still, in my opinion, is safer than injecting a needle in this area. And to me, it's not even that you need to be on bone. You just need to be underneath the SMAS. As long as you're underneath the SMAS, you are injecting in that deep medial cheek fat, which is the whole concept of injecting on top of the bone on the piriform space. As long as the product is between the SMAS and the periosteum, you're going to get the same effect of that anterior projection and a little bit of superior displacement of the tissue. If you're on top of the SMAS or underneath the skin, you can actually make that area look heavier and drop it down. So I'm going to show you how easy it is with a cannula. And again, the reason I prefer the cannula is because all I'm feeling for is a little bit of the pop that lets me know that I've gone through the SMAS, which is certainly that fibromuscular layer that separates the deep space from the superficial space. So we've done the entry point kind of on the lateral aspect of the cheek, right near the suture line. And what we do is we go straight in like this. And so I'm pushing, but I'm going to pinch the skin, twist it, and now I'm tapping on the bone. Now, that doesn't necessarily mean you're underneath the SMAS. You have to orient it towards the nose and gently push it in. And now we're under the SMAS because when I lift up the cannula, you see very low movement in the tissue. We're in the deep space. I will start to inject very slowly, always observing the skin. And right now, I am superior and slightly lateral to the zygomatic cutaneous ligament. And we're going to enhance. This is basically enhancing the SOOF. And over here, I may start with anywhere from about 0.5 to 0.7. And again, I'm using the cannula to move. And I'm making sure I'm under the SMAS. We're going to finish off just a little bit more here at the apex. And as you can see, that was quick, relatively pain-free, I would imagine, and that part is done. The next area we're going to do is just a little bit about 0.2 to 0.3 in the piriform space. That again gives us a little bit of superior displacement and anterior projection. Oftentimes, it can also soften the appearance of the nasolabial fold. Sometimes I've noticed that if someone is getting a little bit of jowling, just these two placements will soften the jowls a little bit. You don't need to do a lot. And then I may come down here and further refine it a little bit more by really making the jawline a little bit more linear, especially in this region where we are dealing with the lateral and medial chin fat. And then using the cannula just a little bit subdermally, I'll further refine it a little bit more. So it's the same thing here. Again, I don't need to go to the bone. What I'm looking to do is, first of all, I want to enter the skin. Okay. And now same thing. I'm going actually kind of posteriorly because this space does kind of go a little bit deeper. And I'm just looking to feel a tiny pop. Great job. And now we're in that space. And again, you want to inject slowly here, very slowly. And so I'm just going to be putting about 0.2 to 0.3. Oftentimes, these two injections can also support the trough. You're doing okay so far?
Mm-hmm.
Great. And as you can see, that's it.